matter where or who you are or where you're from, sometimes depression can set in. And here in the 716, we're taking a look at Depression Awareness Month with our friends over at Brylin Hospital. Joining me now in the Daytime Buffalo studio is Dr. Wendy Weinstein. Hi, Dr. Wendy. Thanks for coming in.
So nice to have me. Thank you so much.
Okay, so now we know that unfortunately it's Depression Awareness Month,
Right.
which, why don't you start off by telling us kind of the facts behind depression, because it's a very common mental illness.
Depression is a really common mental illness. In fact, 1 out of 20% of people will suffer from depression this year. That's about 1 out of 5 people. But only half of those people go for treatment.
Okay.
Now, depression is very common. It's not just having a bad day. It's more about feeling depressed or lacking interest in things that you used to enjoy. It's maybe feeling clouded. You can't concentrate as well. You feel like you're a bother to people. You feel overwhelmed and hopeless. And your get up and go sort of has just left you.
Now, unfortunately, what is the #1 cause of suicide?
The #1 cause of suicide is depression. That's the #1 cause of suicide. And in children ages 10 to 24 years old, that's the #1 cause of suicide.
Let's talk about some of the signs of symptoms and what are the warning signs that we can look at, especially friends or family?
So if there's a change in behavior, let's say a person normally likes to garden, for example, and they just have become isolated and they don't want to do the things they normally used to do, or they used to be very social and want to go out and do things with people, and they're just isolating. Or they just say, I don't feel like it, or I don't care. A big one is I don't care. Another big thing is that if you think someone may be suicidal, one of the hints is that they start giving things away.
Right.
Because they're starting to get rid of things in their life that they used to enjoy.
What are some of the self-care tips for mental wellness?
Huge. Take care of yourself. It's not selfish to take care of yourself, because if you can't take care of yourself, you can't take care of anyone. Exercise, rest. These are things we all know about, but do we put into practice? Not necessarily. Rest, mindfulness, getting out of your head, helping someone else. I always find when something is upsetting me, if I can get out of my head and help someone else, it puts me in a much better place.
And what are some of the ways that we can kind of be practicing mindfulness? Because depression is treatable, right?
It's so treatable with medication, with therapy. It is extremely treatable. But you have to realize that you don't necessarily have to be depressed, so to speak. You can just have lost all of your interest in things. That could be enough.
And what are the best ways for people to contact you at Brylin Hospital if they're realizing that depression is what they're dealing with?
Well, Brylin Hospital is an acute care center. If someone's in crisis, they can Google Brylin, they can just Google Brylin.com. And we also have the number up there as well for us, 886-8200.
Well, thank you so much for coming in. It's a hard topic, but it's something that we need to talk about.
It's so treatable.
It is. And it's such a common thing, especially in Western New York. The weather's changing. A lot of people start to be feeling these things, but know that you're not alone and know that there's help.
It's okay to ask for help.
Absolutely. Thank you so much,
Thank
Dr.
you.
Wendy. And again, depression is treatable, and Brylin can help. Just call 716-886-8200 or go to brylin.com for more. Thanks so much.
Thank you.